My name is Deborah Coltrane, and I'm Director of Corporate Relations for Pocket Nurse. Pocket Nurse is a nurse-owned, unoperated company, and we sell medical supplies and equipment for simulation. But beyond that, we're very much an advocate for networking for simulation users, and we have identified HealthySim as the perfect venue for simulation, not only directors but sim technicians, to network and expand the knowledge base of simulation. And it is indeed our pleasure. We've now been a sponsor of HealthySimulation for 2 years, and we are just thrilled with our relationship, and we will continue to sponsor not only HealthySim but all of its projects into the future.
My name is Kim Baily, and I'm an educator at a community college in Southern California. And in my previous experience, I've been responsible for establishing a simulation program within our nursing department, for being involved in the development and planning of a brand new simulation center, and for the day-to-day operations of a nursing program, which requires a lot of input, supplies, and equipment.
And we're very happy to have El Camino Community College as one of our great customers who have been with us for years. And as with most community colleges, we're very, very supportive of their needs. And they've really mentored Pocket Nurse in what type of supplies and equipment they need for their programs and development of their simulation labs. One of the things that we pride ourselves in is that not only our low cost, but our willingness to sell them eaches of products. You know, in the past, they've had to buy caseloads of alcohol wipes or many kinds of disposables. We're happy to sell one box of alcohol wipes to meet the budgetary needs. So we thank you very much for your ongoing support. As you've grown, we've grown as well.
I think the important thing as an educator is, that, especially if you're using simulation, that you have students come into the sim lab or whatever lab you have, and they have realistic pieces of equipment and medications to use. And I've heard students say, well, it's only simulation, it's not real, we'll just pretend to wash our hands, we'll just pretend to give the medication. And so if you really want to have a program or a group of students come into the classroom and have a valid experience, you have to provide them with the equipment that mimics what they see in the hospital. Otherwise, it's not a real life experience. And the students then step back from the learning and say, well, it's not real, and so forth. So you have to have that. And you know, we have had a long relationship with Pocket Nurse, and one of the things that's been really great is, as we started to see the need for different medications, we really wanted to do Code Blue and those kind of things. We needed those meds that we had in using Code Blue in the same kind of format and packaging that the students would see. If it wasn't the same and they didn't have to open these rather specialized vials and equipments and that kind of thing, then it threw them when they got into the actual situation. So it has been great working with Pocket Nurse, because they've been so willing to say, well, what is it that you need? And lo and behold, that piece of equipment or that medication has shown up. You know, their blood products and their IV supplies. It looks exactly like we use in the hospital. So students buy into that, and they can see that they feel like they're having an experience. But then when they walk into the clinical situation, it's no surprise, because they've seen it and they've seen the equipment. So it has been a good relationship, and the costs are very reasonable. And that's another thing. If you've got a limited budget, I'm in a community college, so we don't have a lot of money to spend, and we can get our supplies for a reasonable cost and what we want, and not a lot of stuff that we don't need. So it's been a win-win situation for both partners. Yeah.